Hi, I'm Dr. Tori McJunkin with NevadaPain.com, and I wanted to talk to you about transforaminal epidural steroid injections. Transforaminal is a certain approach that many physicians will use to place medication in the epidural space. It's different than a labor epidural or the common approach that physicians take when they place an epidural catheter for women in labor, where they come straight in the midline. In a transforaminal, a smaller needle is directed underneath bone with x-ray guidance in a more oblique fashion.
Here's the disc that's being degenerated. We're going to oblique over this way, and then we'll slide right underneath the pedicle on each side. So first we're going to oblique to the right side, which you'll see. Perfect. Here's our pedicle, supraarticular process. We're going to go right under that area there.
You're going to feel a sting or burn. This is the numbing medicine. So numbing medicine right here. And then you feel some pressure. Picture there. That's our needle going right into that area. We're just going to steer it down right underneath the pedicle. And that's a nice angle right there. That's touching bone right there, so it's going to be a little more inferior and advance just a little bit. Then we're going to come over to the opposite side. Same thing. We're going to go right underneath that pedicle there. Big sting and burn here. A little pressure here. This is the needle going in. We're just going to straighten our needle so it goes right underneath that pedicle like the other side. Okay, then we'll look at an AP and we'll see kind of where we're at. So we could advance this one on the left just a little bit more. We can advance this one on the right just a little bit more. Then we'll go to a lateral view. Okay, so you can see the neuroforamen right here. So the first needle is almost all the way there, and the second needle just needs to be advanced a little bit more. So I'm going to advance that second needle a little bit more. More pressure here. A little more pressure. A little more pressure. I'm going to advance that first one just a touch more. Okay, that's perfect. We'll come back around towards AP. And then we'll put a little bit of contrast through each needle. You might feel some pressure as we do this. So that's perfect, spread right into the epidural space and along that nerve root at the L4 level. We're going to put some on the right side. Perfect. What we're making sure is there's no vascular uptake and contrast. Make sure that the medicine goes where you want it to go. Now we're putting in a mixture of 1/4% bupivacaine saline and decadron, which is a non-particulate steroid. For more information about transforaminal epidural steroid injections or other procedures, please visit NevadaPain.com. We change lives here.